The passion is just the governor. I give you a story. A few weeks into his administration, and I came to him and I said, Your Excellency, sir, I think before we start a health insurance scheme, we need to check out what facilities are available to provide care. And he gave me a vehicle and I went around, visited facilities, and I came back to him and I said, Your Excellency, these are the facilities I went to. He looked at it, he said, Ben, until I see you in the very rural healthcare centers ensuring services there, that's when I'll know you've started your job. And that was a great incentive for me to go into the rural areas because these are people that have been disadvantaged, they haven't had this care, and we believe that if we are not able to provide that during his tenure, we would have achieved nothing, because we shouldn't let anybody be left behind. The idea is whatever service we're able to provide in the urban centers should also be in the rural centers. Now, we even have the hard-to-reach, very rural community like Polobubo, Oporoza, Obembri, and all those areas. We ensure that we go there. Your socioeconomic or geographical location should not be a disadvantage. It should be a stimulus for us to even reach out to you the more, because those people don't have that opportunity of even having proper logistics to come into town. So we should ensure that whatever they have there is what can sustain their health and ensure that they live a healthy life. So that is why we've decided to ensure that the facilities in Polobubo or Poroza are standard hospitals that should be able to take care of healthcare. So the driver, the incentive is actually what we get from the inspiration, support, and guidance from His Excellency Senator Dr. Ifeanyi.
Delta State is about to do what anyone else has not done, even in Africa, aside from some couple of people we're talking to, but they have been the forefront of this engagement. Is more of capturing people into the primary healthcare services and managing people. Identity management is a key. So, and they're, conforming with the national identity management to make sure that they have the right people captured, both the old, the young, female, male, poor, and the rich, into their database, so they'll be able to care for a lot of people health-wise.
I can say it's a great thing that the Delta State contributory health scheme is doing. And in particular, I think the Delta State government, because this is, I can say, it's like a unique kind of stuff that they're doing, bringing in so many of people in the remote, rural, and the cities into their health scheme. And when they say health is wealth, when you have a very healthy populace, you are sure that productivity is going to be on the high side. And we all know that it's not also cheap to attend healthcare services, and what they've just done is trying to, I would say they've just virtually subsidized the healthcare services for their citizens, their people of Delta State. And I will advise, I will strongly urge Deltans to really take advantage of this, because you just need to, it's just like an insurance scheme. You pay a small amount of money and you enjoy so much benefit. So to me, I think this is the way to go, and I think they've gotten it right. And I would say I'm really impressed with what they've done so far.
Well, this is a very good step, a very good initiative by the Commission, and it's obviously going to yield a positive result. And with this, almost everybody will get health solutions. Everybody will have access to health, because like moving around, the whole idea of this to move around, register everybody, and everybody having the opportunity to, like I said, to health services in the state. So it's a right move in the right direction for the Commission, and also going to be advantageous for Deltans and for Nigerians.
That as many people that have benefited, have seen the importance, should also help us spread the message. Because the United Nations mandate is universal health coverage by 2030. But we're trying to see if we can even achieve it by 2023. And that's our new vision, and we're trying to see how we can get that. You know, I always believe that if you want to shoot above all trees, aim at the sky. If you aim at the top of the tree, the latency, you will not get it. So if you aim at the sky, you shoot above all trees. So we always aim very high, and we'll do our best to achieve it. So our target now to see what can we do to achieve universal health coverage in 2023. If we're able to meet it, fine. If we're not able to meet it, we would have been closer to the goalpost, would have been closer to the end point. That's our current vision. And it's going to be a holistic system. We want everybody involved, and that is what we want to be able to achieve.
Actually put it in the right direction, because without technology, without automation, you can't achieve anything. The world is drifting into technology, and the only thing you can do, you use technology to drive an effective economy, either being health, being housing, being financial, whatever it's called. You need to use technology to make it happen. And they are actually going in the right direction. I can tell you that 100%. And considering the type of DG they have here, I'm sure he's well exposed, and he doesn't want to leave any stone unturned, rather than to put this in place so that the people, the ordinary people who doesn't have access to healthcare, can easily be accounted for, and they would be able to identify who they are along their ethnic group, their environment, and their community.
I think Africa or Nigeria has gone to a level where we should begin to take this serious. In the other climes, they have some kind of health insurance that enables them to access medical service wherever at any point in time. And to me, I think all other states should emulate this. People should not be dying for things that are already preventable. So it's something that they should be done so that people can walk to any healthcare center within their locality and get access. And what are they paying? Just paying what I see here is more a pittance, it's peanuts. And the way it is, I mean, with the solution that is even provided for, anybody anywhere can pay on your behalf. Just give them your DIN number and say, look, please, I'm not feeling well. I need to pay my premium. Please, can you help me? I don't know if it's 2,000, 1,000 or so. And with solution we provided, just dial the necessary USSD string, and your premium is paid, and you can access any healthcare system within the catchment area, within those that are selected to be part of this system. So I think all states should take a cue from this and ensure that their people enjoy healthcare to the best of their ability.
Yes, it's because without data just means information, and in this situation, information about you. Without information about you, people don't know how to help you. Especially when we're talking about health-related matters, people have to know not just information, but sensitive information about you. This will help the Commission to be able to provide the right treatment and the right solution for the people.
The point is, health is not just about that somebody walks into a facility, gets a medication and go home. No. How do they live at home? How are they well-being? What's their mental status? What's their feeding like? What is their perception to life? You know, so there are social factors that implement and direct a better healthcare. So we ensure that those social factors are also taken care of, while ensuring the clinical pathways are adequate and compliant with best practice expectations. So we look at our service delivery from a holistic point of view. We're even now going into a financial inclusion to ensure that people living in the rural areas are able to be part of the financial system, ensuring that we get them a national identity number, we get them included in the social register, so that social safety net programs, they are part of it, and they're able to participate in various programs. We do outreaches. We have set up a diabetic and hypertensive clinic in some rural communities. We go out to reach them. So the whole idea is that ensure that you give them that sense of purpose, that mindset that they are not being left behind, that they are part of the entire universal ecosystem of quality healthcare service delivery.
We've been to a lot of places in the world, and the number one thing is to know who you are giving healthcare to. You cannot plan without knowing who you are dealing with. And that is why most of our African countries are failing. And they have taken the right step in the right direction by, number one, identifying all the citizens of Delta State. Then when you know the number of children, the number of pregnant women, the number of old age women or men, you'll be able to cater for them. So the direction is fantastic, and that is the only way, the difference between the Africans and the Western world. Because the plan, when you fail to plan, you plan to fail. So the number one thing they are doing now is to planning, putting the right perspective, going through the right perspective to get things done. Yes.
Absolutely, I'll agree. The Health Commission has gone into overdrive because it's an innovation, it's a new move, and it's a way of increasing the awareness in the digital space.
He's always guided us, he's always directed us, he's always supported us, he's always given us the enabling environment and the energizers to achieve. So what we're doing is in line. And one significant component which is very crucial for this kind of program to succeed is what I call a strong, significant political will. People usually talk about just political will. No, the political will has to be strong, it has to be significant, it has to be strategic. And we got all this from the governor, Senator Dr. Ifeanyi Okowa, and that's what has enabled us achieve what we're achieving today. And we intend to achieve more before his tenure ends.